When talking about diabetes, the focus usually falls on blood glucose levels and medication use. But what if I told you that one of the keys to controlling type 2 diabetes lies in nutritional deficiencies that silently disrupt your sleep? Yes, it might sound counterintuitive, but many issues faced by diabetics, such as insomnia, cramps, and even night sweats, could be linked to unnoticed nutritional gaps. These deficiencies not only affect rest, but also exacerbate high blood sugar symptoms, making treatment even more challenging. What few understand is that the imbalance of essential nutrients, like magnesium, vitamin B1, and potassium, can turn a peaceful night into a battlefield. Each deficiency triggers a chain reaction, causing symptoms that range from frequent urination to headaches and even high blood pressure. That's why many spend years battling diabetes complications, without realizing that the real culprit might be something as simple as a poorly planned meal. This is a rarely shared insight, but it can be a game changer for those seeking to improve their health and, of course, sleep better. Imagine having peaceful nights without that annoying leg sensation, the burning feet, or the sudden heart palpitations that come out of nowhere. Understanding how these deficiencies impact your body can be the first step in transforming the way you manage diabetes and regaining control over your quality of life. Want to know how that's possible? Let's dive into the details and uncover this connection between diabetes and sleep that few specialists talk about. Restless leg syndrome, the effect of excess sugar on muscles. Restless leg syndrome is a bothersome sensation that unexpectedly appears and disrupts many diabetics during the night. It feels like a strange energy has taken over your legs, preventing you from relaxing and sleeping deeply. This phenomenon is often underestimated, but can actually be one of the signs that high blood sugar levels are causing a muscle imbalance. The deficiency of magnesium and vitamin B1, caused by a high intake of sugars and carbohydrates, is one of the main culprits in this situation. Thus, diabetic symptoms can sometimes be mistaken for simple discomforts, but a deeper look is needed. When there's a nutritional deficiency like this, the muscles go into a constant state of stress. What starts as a mild tingling can progress into an intense feeling of restlessness that disrupts any attempt to rest. It's like trying to sleep while your body seems to have a will of its own. This condition is common among those with type 2 diabetes and other variations because an overloaded body cannot process essential nutrients correctly. In such cases, it might be crucial to reevaluate your diet and reduce sugar intake, while supplementing with magnesium and vitamin B1. A practical approach would be to include more foods like nuts, seeds, and spinach in your daily diet. Additionally, targeted supplementation can help alleviate these symptoms quickly. When well managed, restless leg syndrome can be minimized, allowing for more peaceful and restorative nights. And that's just one of the effects that deregulated blood sugar can cause. Other signs, like burning and numbness in the feet, also indicate that something is wrong in the body. Peripheral neuropathy, burning and numbness in the feet. Peripheral neuropathy is a condition that many diabetics know well. The feeling that your feet are on fire, or the numbness that seems to sever the connection between the brain and the extremities. This discomfort tends to worsen at night when the body should be resting, but is instead trapped in persistent discomfort. The main cause is prolonged hyperglycemia, which damages peripheral nerves, resulting in continuous pain and discomfort. What begins as a slight tingling can evolve into a more profound and debilitating sensation, directly impacting the individual's quality of life. The root of this problem lies in high blood sugar levels, which act as a corrosive agent on the nerves. Over time, this exposure damages nerve endings, leading to these diabetic symptoms that worsen as the condition goes untreated. The pain caused by neuropathy is often described as a constant burning sensation, like having your feet in contact with hot coals. For many diabetics, the nights become a real challenge because rest is compromised, and the discomfort cycle perpetuates. Want to know how to ease this sensation and have more peaceful nights? Check out the link pinned in the comments and find out how some simple changes can make a difference. The good news is that there are practical approaches to alleviate this condition. One of the most recommended options is the supplementation of benfotiamine, an advanced form of vitamin B1 and alpha-lipoic acid known for helping repair nerve damage. Including anti-inflammatory foods, such as turmeric and fish oil, can also make a difference. These nutritional adjustments, combined with strict glycemic control, help reduce pain intensity and allow the body to start regenerating. However, the problem isn't limited to foot pain. Nighttime cramps can also be a sign that something is off in the body's mineral balance. Nighttime cramps, when magnesium deficiency causes muscle contractions. Nighttime cramps are more than just a minor nuisance. They're a wake-up call from your body indicating that something is out of balance. Many diabetics experience these painful muscle contractions at night, especially in the legs and feet. They appear suddenly, as if a knot has formed in the muscles, preventing any attempt at relaxation. The primary cause is the lack of magnesium, an essential mineral for proper muscle function that, when deficient, allows calcium to accumulate in the muscles, triggering these sudden contractions. In the context of diabetes mellitus, this symptom is often a reflection of internal metabolic disorder. Magnesium imbalance is common in people with type 2 diabetes, as the kidneys tend to eliminate large amounts of this mineral, along with excess glucose in the urine. As a result, the body can't store adequate levels to regulate muscle contraction and relaxation, which worsens cramps. It's like the body is in a tug-of-war, never reaching a point of rest. Moreover, frequent urination and excessive thirst, which are classic signs of high blood sugar, further contribute to this loss of magnesium. To relieve cramps, magnesium glycinate supplementation is highly recommended because it is easily absorbed and gentle on the digestive tract. Additionally, foods like bananas, avocados, and almonds can be added to the diet to help restore magnesium levels naturally. However, it's important not to ignore this symptom, as it's just one sign that the body is struggling with mineral dysregulation. Another common issue is excessive sweating during sleep, a body's extreme response to a state of uncontrolled hyperglycemia. Excessive sweating during sleep, the body in emergency mode. Excessive sweating during sleep is one of the most subtle, yet also one of the most unsettling signs for those suffering from diabetes. Imagine waking up in the middle of the night drenched, as if you just run a marathon. This happens because the body, in response to high blood sugar levels, goes into a state of extreme alert. Elevated glucose levels force the sympathetic nervous system to trigger a fight-or-flight response, as if the body were in constant danger. And when the body activates this response, sweat production increases significantly, creating this discomfort that robs you of a peaceful night's sleep. Excessive nighttime sweating can also be an indication that the body is struggling to maintain stable blood sugar levels during the night. This symptom is usually accompanied by other signs, such as heart palpitations, feelings of anxiety, and even morning headaches. It's as if the body is desperately trying to regulate its glucose levels, but without success. For diabetics, this is a response that can go unnoticed, but indicates a dangerous state of hyperglycemia. That's why monitoring blood sugar before bedtime is an essential practice to avoid these nighttime surprises. To reduce sweating, glycemic control is fundamental. Lowering carbohydrate intake before bedtime and avoiding stressful situations are practical steps that can make a difference. Relaxation techniques, such as guided meditation and deep breathing exercises, also help calm the nervous system before sleep, promoting a more peaceful rest. However, this is not the only threat that can go unnoticed at night. Nocturnal hypertension, known as non-dipping, is a silent danger that also deserves attention. Nocturnal hypertension, non-dipping, the silent danger. Nocturnal hypertension is one of the most treacherous problems faced by many diabetics, often without them even realizing it. During sleep, blood pressure should naturally drop, allowing the body to rest and recover. However, in people with diabetes mellitus, this process can be interrupted, causing what is known as non-dipping, where blood pressure remains high or even increases. This phenomenon can be a sign of poorly controlled diabetes and is directly linked to dysregulation of blood glucose levels. It's a true silent thief of health, as many are unaware of this danger until more serious complications arise. This off-hours high blood pressure is more than just an elevated number. It places extra strain on the heart and blood vessels, increasing the risk of cardiovascular events. Waking up tired, with palpitations or a sense of restlessness, can already be an indication that the body is overworked during the night. People with type 2 diabetes frequently suffer from this problem due to insulin resistance and glycemic instability, factors that contribute to the constant activation of the sympathetic nervous system. And this state of hyperactivity, instead of shutting down during sleep, continues at full throttle. To manage nocturnal hypertension, it is crucial to monitor glucose levels and adjust your diet to ensure effective control. Foods rich in potassium, like sweet potatoes and avocados, can help regulate blood pressure. Additionally, limiting sodium intake and maintaining a regular exercise routine are simple steps that can have a significant impact. However, foot cramps caused by a lack of electrolytes can also interrupt sleep and further hinder the rest of someone already dealing with this condition. Foot cramps: how electrolyte deficiency interferes with sleep. Foot cramps are a common discomfort that can strike unexpectedly, usually in the middle of the night, causing anyone to wake up with sharp, throbbing pain. For those living with type 2 diabetes, these nighttime cramps can be more frequent and intense, reflecting an imbalance in the body's magnesium and potassium levels. The lack of these minerals triggers involuntary contractions, especially in the feet and calves, which become more evident when the body is at rest. In other words, it's as if the muscles are suddenly awakened by an electric current, interrupting sleep and causing a discomfort that's hard to ignore. Excess glucose in the blood and frequent urination are two of the main reasons for this electrolyte deficiency. The loss of essential minerals in urine, combined with the effect of high blood sugar, disrupts the electrolyte balance and leaves the muscles more prone to painful spasms. That's why this symptom is a clear indicator that the body is losing more than it should. Imagine trying to rest with a muscle that contracts suddenly every time you attempt to relax. It's a constant battle that compromises sleep quality and physical recovery. To prevent these cramps, magnesium supplementation and the inclusion of potassium-rich foods, like bananas and coconut water, are essential. Additionally, small changes in your routine, such as gentle stretches before bedtime, can help relax the muscles and reduce the frequency of these nocturnal spasms. However, when it comes to diabetes symptoms and signs of high blood sugar, these cramps are just one piece of the puzzle. The relationship between nutritional deficiencies and diabetes goes far beyond muscle pain, affecting even sleep patterns and overall well-being. If you want to better understand how these deficiencies impact your health and discover effective strategies to improve your quality of life, click the link pinned in the comments. There, you'll find complete and practical guidance to transform your routine and stabilize your diabetes. Concluding, now that you understand how these nutritional deficiencies affect the sleep of those living with diabetes, the question is, what are you going to do with this knowledge? Will you ignore the signs and continue suffering from poor sleep, pain, and discomfort? Or will you apply these strategies to take back control of your body and finally achieve the rest you deserve? Think about it. Each dietary adjustment, each supplement introduced with purpose, could be the difference between a restorative night's sleep and a whole night of discomfort. So why not start putting everything you've learned into practice today? The secret to transforming your health is in your hands. Taking the reins of your own well-being is more than just a choice, it's a commitment to your future. If each change can bring you a better night's sleep, and each restful night can improve blood sugar control, imagine the positive impact in the long run. Don't let diabetes continue to control your life. You already have the tools. Now it's time to take action. By the way, what will be the first step you're going to take? Magnesium supplementation? Adjusting meal times? Share your ideas in the comments, and let's discover the path to healthier sleep together. If you want to keep receiving content like this and learn more about how to handle nighttime diabetes symptoms and improve your quality of life, subscribe to the channel and turn on notifications. This way, you won't miss any of our videos and will always stay up to date with practical and effective strategies to transform your routine. After all, every step towards a more balanced life is a step towards complete control over your well-being.